We'd like to introduce you to Sisters Who Care. And they do care because they're trying to do an awful lot for the community. I'm going to let them introduce themselves. We're going to talk about their program. Good morning, ladies.
Good morning.
Kind of ran in, and here we are, getting busy and getting ready today. So, Sisters Who Care, you've been here for quite a long time doing what you do. Explain what it is as far as education and support and giving people the knowledge and the empowerment that they need. Who wants to jump in?
Well, I can just share real quickly that our agency, COPES, which was founded by our executive director, Ted Strader, has been in the community for over 30 years.
Yeah, 35 years.
And so we've done a lot of work with professionals in the school system, both the public and parochial school system, with the U of L Athletic Club and athletic teams. And so over the years, we've just kind of found our niche in working in the prevention field and with families.
Which is always good. Prevention first is always good, whatever that may be, HIV or drug use or stress or whatever. So that's always good. Prevention first.
Yeah. So currently we're funded through the federal government through a SAMHSA grant, and we have a program called Sisters Who Care, and that's what we've been doing for the last 2.5 years, and we want to continue to do that work here in the community, particularly with African American females.
Okay. Did you introduce yourselves? Did I?
I don't think so. I'm Brooke Arnold.
Brooke.
Yes.
Yeah. Well, here we are talking. I do that all the time when I MC a program. Give your name.
I'm Tanisha Curtis.
Right, Tanisha. All right. So Brooke and Tanisha. So Tanisha, where do you come in this program? Why is it so important for you?
Well, for me personally, because as trainers, we actually facilitate the program, but we've been through it multiple times on our own. For me, it's been just phenomenally life-changing. It's worked like magic just to have the skills to be able to strengthen my relationships with my family, with my friends, and with myself, my own self-awareness and emotional expression and things like that.
But Tanisha, seriously, think about it. I mean, I'm being serious. How often do we work on that? How often do we work on that? We will do everything else and then wonder why everything else is falling by the wayside.
Exactly.
But you've got to work on self. You should work on family because that's generally the most important
relationship,
and relationships and learning how to handle interpersonal relationships.
Exactly.
I don't think, I could be wrong. I know I don't. Let me talk for me. I don't think most folk work on that.
Sure. Or sometimes they try to, but again, they just don't have the skills. Exactly. And that's what we try to facilitate. So people give short answers to certain issues, like saying something like hug your child with your words or drink responsibly, and that sounds great.
It sounds good, but if you don't know what it means, you don't know how to do it.
Exactly. So we try to offer those concrete skills and concepts that you can actually apply in your life.
All right. The latest thing you're taking on is folks being aware and protecting themselves from HIV. I personally think, and again, these are just personal opinions here, that people have kind of kicked that again to back mind, and we're not thinking about it. Thinking that's an old disease. It is still prevalent, and I know here in the city, it's African American women that are being hit hard.
Exactly.
And so we're trying to just educate and try to reduce the stigma that often comes along with HIV. And it seems like a lot of people just are even scared to talk about it, and that might
nobody wants to talk about it. I think still people are afraid of people who have HIV. You can't get it by hugging somebody or shaking somebody's hand or sitting too close. Or, and it's, I think we started off with a big boom of knowledge, and maybe that's dropped off. Is that true?
I think so. I think there are some conversations, but sometimes there's just misinformation that's being given because of people feeling scared or just not knowing.
How do we become a part of you? How do we use your resources, and then how do we support you to make sure you continue this?
Well, we're really looking for, first of all, in general, anybody that's interested, especially African American females over the age of 18, though we wouldn't deny anybody services who wanted to come and join us. But we'd really love to be able to get groups of ladies, whether it's you and your 14 sisters or
if your
church
girlfriends
group.
can go out for a drink and a party, then you ought to be come in and take care of yourself.
We would love that. Absolutely.
How would you love to just have a Cope community party day for the ladies?
Pretty much, we make it fun and engaging and conversations, and
how do they do that? If they want to use your resources, how do they make that happen?
They can call us at our office, which is 583-6820. We also have a Facebook account, Twitter. We're also on YouTube.
Gotta have that.
That's right.
You gotta have that. There it is. I mean, COPE, Sisters Who Care. You are responsible for you. It seems like that seems to be the theme today, promoting personal and interpersonal skill development, health promotion, prevention. What more do you need? And do you all need donations to continue work like this? Or
we're certainly open to it since we're a nonprofit, but we're very excited because our programming is evidence-based, and we now have 3 programs on the National Registry of Evidence-Based Programs.
So yay for you.
We're excited about continuing this work and spreading the word and news about it.
All right. We appreciate that you're caring for our community, and especially our ladies. Thank you very much. All right, when we come back, okay, so we counted the sugar. Coming up next, we're not going to count anything. We're just going to count on having a good time and a good meal. That's what we're going to do. Come back.